The connection between depression and diabetes is something that I think has really only got a lot of attention in the last 10 years. Prior to that, I think we just felt, well, people sometimes, they have depression, but it wasn't really recognised that if you have diabetes, you've got probably twice the risk of developing depression. Now, there have been numerous studies done in both type 1 diabetes and type 2 and in a number of cultures, and it's a fairly consistent finding. So the recognition that, hey, this condition of diabetes does predispose to a greater rate of depression is now well and truly understood. Someone with type 1 will usually be seen fairly quickly by an endocrinologist if they live in the cities. If someone with type 1 diabetes lives in the country or in an isolated area, they often may not see an endocrinologist for quite some time after their diagnosis. And so by the time they see me, it depends on the stage of their condition, how long they've had it, and how their coping can vary enormously. So some people will react with great stoicism initially, and then they drop their bundle. Other people will sort of muddle through somehow and maybe just progressively improve and get used to it and so on. But the most common reaction is initially shock, and then later on the reality sits not very well with them, and people will often tell you that they want this condition to take a holiday, and it won't. Psychological factors are extremely important in this condition, and the psychological factors kick in pretty much straight away, but they're often under the surface, and the person doesn't realise it, and often we don't notice it, that the person may actually have a lot of anxiety, which is understandable and quite natural. They'll often feel very upset, and you may find people will progressively lapse into depression, which is about twice as common in people with diabetes compared to the general population. And as time goes on, depending on how the diabetes is affecting them and how it's managed, the person may get a lot of psychological distress and a lot of emotional problems. If somebody's got depression, or if somebody's very anxious, and then you ask them to do a whole lot of things that reinforce the importance of diabetes and having to prick the finger, check the blood sugars, write down the blood sugars, take the insulin, make sure you work out that you're not going to miss a meal. If you're going out at night with your mates, take your insulin and so on. That can have a big effect if a person's got depression, because trying to get themselves organised enough to do all those things and at the same time live a reasonable life can be very, very challenging for a lot of people. Patients often won't mention depression, and often they don't flag it, and you have to really look behind what's going on, and frequently you find that all your various tricks and all your changes with insulin and trying a different insulin and having a different diet, none of that will work if you don't get to the underlying problem, which may often be depression. So the clues that you tend to look for are variable depending on the age of the person and what's going on in their life. But if a person previously had very good control, and then all of a sudden the blood sugars aren't so good, and the hemoglobin A1C, the 3-month average, is rising, you've got to start thinking, well, how are you coping with this? And this must be pretty hard. And you throw out a few questions like that, and sometimes you'll get people who suddenly say, it's bloody awful, I hate it. And then you can start to talk about what's really, behind the deterioration in control. We often rely upon helping the patient to say, right, I do think I have a few issues here. We start to explore those issues, but then we need to often refer people to other professionals. And so the GP is often the linchpin if the person's got a GP. Now, when we're talking about type 1 diabetes, often you'll say, now who do I write my referral, the letter back, who's your referring doctor? So, I never see that doctor. And that's because they're 19 years of age and all they've got wrong is diabetes. And they haven't got time to go to doctors and so on. So often they won't have a GP, and this is quite different from people with type 2 diabetes who will often have an established GP. When a person has diabetes, we ask them to do a lot of self-management. And in fact, to get good control, you really have to get a lot of things done. Checking the blood sugars, part of it, making the appropriate adjustments into insulin doses, eating appropriately, getting your blood test done at the laboratory, turning up for your visits, going to the podiatrist perhaps, going to the eye specialist. So there's a lot of processes, a lot of organisation. Now, if you've got depression, and you're finding it hard just to get through the day, just to get out of bed or get to work, and then on top of it we're asking you to do 4, 5, 6 other things, it's not hard to see how depression can have a big impact, a big negative impact on managing diabetes. I think people who are close to someone with type 1 diabetes can really play a very important role in picking up on the early symptoms and signs of depression or anxiety disorder. Often the person with diabetes, type 1 diabetes, is someone who thinks maybe they're indestructible, maybe going through life fairly smoothly, and then type 1 diabetes gets in the way and it's not going to go away, unlike the usual experience of ill health where they might roll their ankle at sport and it'll get better after a few weeks. So with type 1 diabetes, you often get some help if you've got a good support network. If you have either a family member, a parent or a brother or sister, or a good friend, the sort of things that you can look for are with obviously things like withdrawing from normal things that you normally think, well, Fred will love to go to this or, what have you, doesn't want to go. Not wanting to do much outside of their normal work or study, not seeming to be engaging in fun things anymore. Don't find fun much anymore. So a comment might be that, they go out to a party, but they didn't really feel that it was worthwhile, and that they might start, in fact, overcompensating and drinking a lot more. You might find that a clue will be that the person's really, really tired and lost their spark. Now, that could be because their diabetes is out of control. They're not sleeping as well. They're getting really run down. But the underlying problem might be that they're actually getting depressed. I think parents, particularly parents of young children with type 1 diabetes and then going through to adolescence, have enormous psychological stress placed on them. If you think about a parent finding out that their 2-year-old has type 1 diabetes, all the emotions and then all the physical things that the parent has to learn and cope with, and is responsible really for the day-to-day, week-to-week management over and above their normal care of the child. Very, very stressful, and it often falls to the mother. With all the problems that adolescence brings in any event, if you then have on top of that type 1 diabetes, where you're starting to know that you've got to give away control to the adolescent, and the adolescent may or may not be ready. And watching then the child go through to early adulthood and you can see the train wreck potentially coming, but you can't intervene anymore as much. That can be a source of incredible anxiety and stress on the carer. And I just think that the dynamics of that relationship between the parent and the child, as the child starts to hopefully take control, the dynamics are incredibly complex. One of the things that comes up in conversation with someone with type 1 diabetes, a young person with type 1 diabetes, is if they don't yet have a girlfriend or a boyfriend, how are they going to be perceived when they try and establish relationships? So say you've got someone 17, 18, 19, how do you cope with the diabetes, and how do you handle, when do you tell the person, I've got diabetes? And will the other person run away, or will they accept me as I am? that can be incredibly confronting, and for some people remains a source of great anxiety. Similarly, if someone's been in a relationship and it breaks up, they find it incredibly daunting to have to go through it all again and try and find someone who will accept the diabetes and what that entails. And often you find that their anxiety levels seem way out of proportion to what actually does happen when they meet the right person. But it can be a very, very stressful time for a lot of people. There's a concept in diabetes of burnout. People get burnt out from looking after their diabetes. These sort of things that we're asking people to do are boring and repetitive and predictable, and a lot of people just find it very wearing, and eventually for some people it actually will be enough to cause them to develop depression, or at least contribute to the development of depression. So the demands we put on people are quite high, and it's really to be your own doctor. Yet when they come to the doctor, we can often then say, well, you haven't done that right. A lot of times there's sort of typical things that people do really get in the way of type 1 diabetes. So you've got to make a choice. Are you going to plan ahead and not drink too much and then have your wits about you to give yourself the right dose of insulin and check your blood sugar and do everything right? Or you're going to think, I'm going to go out and have a good time and I haven't got my insulin with me, well, bad luck. Now, that sort of conflict is very common, which can drive a person mad, because they think, well, I'm so different from everyone else, and there are quite severe repercussions, because if you don't have your insulin, miss a couple of shots, you might end up in the Alfred Hospital emergency department the next day. And you might end up finding that your friends aren't really that interested in you coming out if you end up that way too often. Now, that's the sort of thing that can put a big pressure on a person and can be one of the precipitants for depression. In terms of treating depression, if someone has diabetes or not, there's not a lot to really worry about in terms of going on antidepressants, which is over and above the normal concerns for someone who needs antidepressants. In other words, most times people with diabetes can take any of the usual antidepressants. Now, there can be specific problems if a person has, for example, a side effect of one of the antidepressants where they might have effects on appetite, either they don't want to eat as much or they eat more, then that's going to have to be taken into account, because you're going to have to adjust your insulin and adjust perhaps other factors. But for the most part, if a person has diabetes and they've got depression to the degree where it's felt that they need antidepressants, then I never hold back on that. And I think it's very important that just because you have diabetes doesn't mean you shouldn't be treated for your depression very actively. If depression is treated, you often see a marked turnaround in the management of diabetes, and you'll frequently see that the results, the biochemistry, is much better. And we often get those results a day or two before the person turns up. And it can be a fantastic thing to see a hemoglobin A1C, which was very high, now very good. And when the person comes, you start the normal way and have a chat and all the rest, and you then find, well, what's different? How come you're so much better controlled? And quite often the person will then start to tell you that, look, actually, I was really depressed and I've now got some treatment and I'm feeling so much better, and my blood sugars are a lot better. They're still hopeless and crazy at times, but a hell of a lot better. And you frequently find that the treatment of depression, although it takes a while, has enormous impact on the physical health of the person, which then has a positive kick on in terms of improving the depression further. So the two are so intimately linked when they're occurring.